Hi, my name's Megan. I'm a graduate student at Aurora University, and this is Richard, who's agreed to let me do a physical head-to-toe assessment on him. Prior to this physical exam, we went over medical history, family history, medications, and allergies. About 3.5 months ago, Richard underwent a right hemicolectomy due to ischemic colitis. Ever since then, he's been recovering well, has no complaints. So, Richard, what brought you in today?
Just an annual checkup.
Okay.
Physical.
All right. So I'm going to do a very thorough assessment on you, starting at your head and then working your way down. If there's any complaints of pain, tenderness, or you feel uncomfortable, just let me know.
Okay.
Okay. So the first thing I'm going to do, I'm going to go ahead and just inspect the head. It's symmetrical. Looking at the back, there's no sores, no lesions, no lumps or bumps. I don't see any moles. Now, if you do have moles, we want them to be round with no abnormal shape or size. Okay.
Mm-hmm.
Do you do self-checks at home?
Yes.
Yes. Okay. Keep doing that. Do you wear sunscreen during the summer?
Always.
Okay. Good. Good. Now, do you have any history of seizures?
None.
Head trauma?
No.
Okay. Any headaches?
No.
Okay. So as far as this assessment goes, Richard's head has normal cephalic. Okay. Moving down, we're going to go ahead and assess the face. Do you have any problem with your sinuses?
No, I don't.
No? Okay. Go ahead and take your glasses off. I'm going to go ahead and palpate your sinuses. First thing I'm going to do is I'm going to palpate the frontal. Okay. I'm going to palpate the ethmoid. And palpate the axillary. Any tenderness?
No.
Okay. You go ahead and put your glasses back on.
Thank you.
Okay. The next thing we're going to do is we're going to test your trigeminal and your facial nerves, okay? By doing this, we're going to use a cotton ball. I'm going to press it against your face. You're just going to tell me where you're feeling it, okay? Okay, go ahead and close your eyes.
Right cheek. Left cheek. Forehead.
Okay, good. You can open your eyes. Now, do you have any issues with grinding your teeth or with TMG?
No.
TMJ, I'm sorry.
No.
No? Okay. What I'm going to do now is I'm going to palpate your TM joint. Okay, go ahead and open your mouth. Close it. One more time. And close it. Did you have any tenderness or pain?
None.
No? Okay, I didn't feel any clicks or anything like that, so that's normal. Okay? Next, we're going to go ahead and move to your eyes. Have you had any eye infections?
None.
None? Okay. Go ahead and take your glasses off one more time for me. What I'm going to do is I'm going to pull the skin down, and I'm going to inspect the conjunctivi. It's pink, moist. I don't see any redness, no drainage. Have you recently had pink eye?
No, I haven't.
No? Okay, you can put your glasses back on. We can see that you wear glasses. In the medical history, Richard said he also uses contacts interchangeably. Do you see the ophthalmologist frequently?
Yes.
Good. Okay. Now, we're going to do a couple tests to test your vision, okay? The first one being a visual acuity test, okay? So what I'm going to do, I'm going to place this card about 14 inches from your face, okay? And I'm going to have you cover up one eye, okay? And I want you to tell me the letters that you see. So go ahead and cover one eye, okay?
EPSO.
Okay. Now go ahead and cover the other one, and then read it backwards.
OSPE.
Okay, great. Okay, the next test we're going to do is called the peripheral vision field test. Okay, this is going to test for your optic nerve. Okay, what I'm going to do, I'm going to stand behind you, and you just let me know when you see my fingers come into the field of vision. Okay.
Yes. Yes. Yes.
Oh, look up.
I'm sorry.
That's okay.
Yes.
Okay, good. All right. Next, I'm going to go ahead and grab this light. Okay, what I'm going to do is I'm going to shine this light into your eyes. What I'm doing here is I'm testing to see if your pupils are contracting equally. Now, when I shine this light into one of your pupils, I'm not just testing for that pupil, I'm also testing for the opposite eye as well to contract. Okay, if they both contract or constrict, I'm sorry, it means that the pupils are consensual. Okay? So go ahead and take your eyes or your glasses off. Okay? Look straight ahead of me, fixate on an object. Okay. Direct response, direct response. Okay, good. You can put your glasses back on. The next thing I'm going to do is I'm going to test for your trochlear, your ocular motor, and your abducens nerve, okay? So go ahead and look straight ahead. I'm going to shine the light between, right on the bridge of your nose, okay? Okay. What I'm doing here is I'm looking for the light to reflect in both of your pupils, and I see the reflection of the light in both of your pupils bilaterally. Okay, so that's normal. Okay, put this down. Okay, another test that I'm going to perform that's going to test your trochlear, your abducens, and your ocular motor nerve is I'm going to have you follow my finger with your eyes, okay? I don't want you turning your head up and down, side to side, just move your eyes, okay?
Yep.
Now the purpose of this is I'm looking to see if you have any extra eye movements. So I'm not seeing any extra eye movements, no nystagmus, okay? Let me grab this. Okay, so the next thing we're gonna do is we're gonna move on to your ears, okay? Just by looking at your ears, they're symmetrical. Okay, I'm gonna go ahead and palpate. Do you have any pain or tenderness?
None.
No? Okay, I'm gonna go ahead and press on your tragus. Pain?
None.
Okay. Have you had any hearing loss recently?
No, I haven't.
Any drainage?
None.
No, okay. I'm gonna go ahead and grab this light. We're gonna take a look in your ears. Okay. Let me know if there's any pain or tenderness. Okay. What I'm doing now is I am looking and I can visualize the tympanic membrane. It's a pearly gray color. And I do see a reflection of the light. There's a little bit of cerumen in here, but that is normal, okay? I'm gonna go ahead and check the other side. Okay, once again, I can see the tympanic membrane. It's a pearly gray color, and I do see reflection of the light. And also there's a little bit of cerumen in here as well, okay? Now, while we're assessing your ears, we're gonna go ahead and we're also gonna test the acoustic nerve, okay? We're gonna do this by, I'm gonna stand behind you, and I just want you to repeat what I say to you, okay?
Okay. 135. 246.
Okay, good. Now another test that I can do to test the acoustic nerve is I can get a vibrating tuning fork. Okay, and what that does is that would test to see if you can hear the vibrations in both ears bilaterally, and that test to see the air and bone conduction. Okay?
Can you do that?
No, not for the sake of this video, we won't.
Okay.
Okay, so moving on to the nose. I'm looking at your nose, it's midline. Do you have any allergies?
None.
No? Any troubles with a draining nose?
No.
No. Okay. I'm going to go ahead and palpate your nose. Any pain or tenderness?
None.
Okay. I don't feel any abnormalities. Okay. What I want you to do is I want you to take your finger, plug one nose, and breathe in, and breathe out, and then do it with the other. Does one seem clearer than the other?
No.
No.
They're both
Okay.
the same.
Okay. What I'm looking for here is if there's any obstruction or if your septum is deviated. Okay. What I'm going to do now is I'm actually going to test your olfactory nerve, which is your smelling nerve. Okay. So what I'm going to do is I am going to put something underneath your nose. It's a scent. Okay. And as soon as you smell it, tell me what it is. Okay. Go ahead and close your eyes.
It smells like alcohol or something.
Yep. Yep. It's an alcohol swab. Okay. So you passed that test. The next thing we're going to do, I'm actually going to take a look inside, okay? Make sure everything is normal in there. Okay, go ahead and tilt your head back a little bit. Let me know if this is uncomfortable. Okay, looking in, I do see that his septum is midline. No sores, no lesions, nothing abnormal. Okay, everything looks good on that part. Now moving down to the mouth. Have you had any sore throats lately?
No, I haven't.
No? Okay. What I'm going to do is I have this tongue depressor. What I'm going to do is I'm going to have you say ah. Okay? So go on. Okay. What I'm testing there is for the glossopharyngeal and your vagus nerve. Okay? Another way that I could test your vagus nerve is by triggering your gag reflex. But for the sake of this video, I won't do that. Okay? Go ahead and open up. I want to take a look inside. You don't say that. Okay, inside it's pink, it's moist. I don't see any redness, no drainage in the back. The uvula is midline. I don't see anything that would indicate a viral or a bacterial infection. Tonsils are still intact, okay, and no exudate, okay. Have you lost a sense of taste at all recently?
No.
Okay. Last test I'm going to do as far as your mouth is I want you to go ahead and stick your tongue to your chin, okay, and then stick it through your cheeks. Okay. All right. So there I'm testing for your hypoglossal nerve, which is strong and intact. Okay. So next we're going to go ahead and assess the neck. Okay. Looking at your neck, your trachea is midlined. Have you noticed any differences in your strength of your hair? Has it become more brittle? Any drier?
No.
Okay. Have you noticed any dryness in your skin?
No.
Okay. Anything that would indicate a thyroid disease? Okay. What I'm going to do now is I'm going to palpate your different lymph nodes. Okay. So I'm palpating the preauricular, your postauricular, your occipital, your tonsillar, your submandible, and then lastly, your submental. Okay, any tenderness or pain when I was doing that?
No.
No? Okay, I didn't feel any nodes, no enlargement. Okay, I'm going to go behind you. Okay, what I'm going to do is I'm going to displace your trachea, okay, and I want you to swallow. Okay? Okay, I didn't feel anything abnormal. Did it have any pain or tenderness with that? Okay. Go ahead and shrug your shoulders and hold it. Okay? Shoulders rise bilaterally. Don't let me push them down. Strength is good. Okay, go ahead and relax. Okay, I'm going to go ahead and test your CVA tenderness. The CVA tenderness is present with pyelonephritis. Have you ever had a kidney infection?
No, I haven't.
No. Okay. All right, I'm just going to go ahead and test. Tell me if there's any pain or tenderness. Any pain or tenderness?
No, nothing.
Okay. Okay. The next thing I'm going to do is we're going to go ahead and move on down to your thoracic. Okay. Have you had any trouble breathing recently?
No,
No trouble breathing?
none.
Okay. I'm going to go ahead and take a look to the side. Okay. What I'm looking here, I don't see any protrusion of the eyes, no barrel chest. Do you have a history of pneumonia?
No, I don't.
No pneumonia. Okay. Any history of coughing?
No.
Okay. Tuberculosis?
None.
Okay, good. Okay, what I'm going to do next is I'm going to palpate your chest. What I'm palpating for is called crepitus. Crepitus is extra air that's trapped in the subcutaneous tissue. Okay, and if it's present, I'll hear kind of a crackly noise. Okay.
Okay.
Any pain or discomfort?
None at all. Feels good.
Okay. And just throughout the assessments I've been watching, your breathing, your rate is normal, your respiration, your rhythm, all that's normal. Okay.
Okay.
So what I'm going to do, I'm going to come behind you. Next thing I'm going to feel for is called tactile firmitis. Okay, what I'm looking for is equal vibration sounds on both sides of your lungs, okay?
Okay.
Go ahead and say 99.
99. 99. 99. 99. 99.
Okay, good. So, lungs, your vibrations on both sides of your lungs are great, okay? What I'm going to have you do now is take a deep breath in and out. Okay, breathe in one more time. And out. Okay, good. What I was testing there, I was putting both my hands on both sides of your lungs. When you took a deep breath in, my hands spread apart equally, meaning that there is no collapsed lung and that both of the lungs are making an effort to work. Okay. Now the next thing I'm going to do with your lungs is I'm going to auscultate them. at you.
Okay.
Okay, your lungs sound clear throughout bilaterally. Okay, so moving down, we're going to go ahead and take a look at your heart. Okay, have you recently had any chest pain?
None.
No? Okay. Now looking at your circulatory system, I'm looking at your fingers, your toes. They're pink. They're warm. No signs of cyanosis, which is bluish discoloration, okay? Have you had any numbness or tingling to your fingers or
No,
toes?
not at all.
Okay. Can I take a look at your hands? What I'm doing, I'm checking for your capillary refill, which is less than 3 seconds. I'm going to take a look at your feet. Okay, and this is less than 3 seconds as well. Now, I've noticed that you have a little bit of swelling to this leg. Okay, you said in your medical history that that's chronic after the surgery, is that correct?
Yes.
Okay. Has that been causing you any problems as well as the swelling goes?
No.
Okay.
No.
Okay, what I'm going to do next is I'm going to take a listen. I'm going to auscultate your heart, okay? Normally I would do this for a full minute. For the sake of the video, I'm only going to do it for about 15 seconds.
Okay.
Okay. Apical pulse is regular, okay? I'm looking at your neck, just looking for any jugular vein distension, which is absent, which is what we want, okay? The next thing I'm going to do is I'm going to take a listen to your central pulses, okay? First, I'm going to listen to your aortic. Your pulmonic. Your second pulmonic. Your tricuspid. And your mitral. Okay, after listening to all the pulses, I heard S1 and S2 clearly. I did not hear any gallops, murmurs, or clicks, which is what we want, okay? And then the last part of the heart that we're going to do assess is your peripheral pulses, okay? I'm going to go ahead and feel for your carotid. Okay, I'm going to feel for your brachial. Okay, feel for your radial. Okay. Feel for your popliteal. Okay, your posterior tibial, and your dorsalis pedis. Okay, all the pulses are present, they're regular, and they're +2. Okay, while I'm down here, I'm going to go ahead and test for Holman sign. Holman sign is an indicator whether a deep vein thrombosis or a blood clot is present. Okay, so if you have any pain, let me know. What I'm going to do is I'm just going to tilt your foot upward. Okay. Any pain in your calf?
None.
None. Okay. So you have no pain in your calf. I don't see any redness or discoloration, so that would be negative for DVT. Okay. Come over here and do that as well. Any pain in your calf?
No.
Okay. Once again, there's no redness or discoloration and no pain in the calf, so that would be negative for DVT. Okay.
Okay.
Okay. So the next thing we're going to do is we're going to go ahead and take a look at your stomach. Okay. Go ahead and lay back for me. I'm going to come on this side. It'll just be easier to see me in the camera properly. Okay, I'm going to pull this up. So just by looking at your stomach, I see that it's symmetrical. I'm not seeing any bulges. It's soft, non-tender. Have you had any history of hernias?
None.
None?
I've never had one.
Okay, good. Any history of, or I'm sorry, have you recently had any gastrointestinal issues like nausea and vomiting?
No, I haven't.
Diarrhea, constipation?
None.
How about some heartburn?
Yes.
Okay, are you taking any medication for the heartburn? Prilosec.
Yeah.
And does that seem to be managing it?
Yes, it does.
Okay,
Perfectly.
good. Okay, so after inspecting the stomach, next I'm going to go ahead and auscultate. I do that before I start palpating just so I don't disrupt anything, okay? If you start having real bad pain, let me know, okay? What I'm going to do first is I'm going to palpate all 4 quadrants of the abdomen. Okay, all 4 quadrants are audible and hyperactive. Next thing I'm going to do is I'm going to take a listen over the spleen. And the liver. And I'm not hearing anything, which I shouldn't, no friction rubs, okay?
Okay.
Next thing I'm going to do is I'm going to go ahead and palpate the stomach, okay? First I'm palpating around the umbilicus, okay? It appears soft, like I said before, non-distended. Is it tender at all? No.
Nope, not at all.
I'm not feeling any nodes, no hard areas. Okay, and I'm just going to grab this. And the next thing I'm going to do is I'm going to percuss for tympani, okay? And what I'm looking, it should be tympanic over the spleen. The reason it should be tympanic is otherwise it would show that the spleen is enlarged. And then dull over the liver, which is what we want. And earlier, as I was auscultating the spleen and the liver, if I heard the spleen, the tympanic over the spleen, it would show that that was enlarged as well as the liver. Okay? So go ahead and put this down. Okay. Sorry, we're going to pull it back one more time.
Okay.
The last thing we're going to do is I'm going to test your abdominal reflex. Okay? So just go ahead and relax. What I'm doing is I'm looking for it to contract, which it is. Okay, go ahead and put your shirt back down. So your abdominal muscle, your abdominal reflex is positive. Okay. So the last system that we're going to assess, you can go ahead and sit up, is your musculoskeletal. Okay? Any lightheaded or dizziness?
No.
No? Okay. Has there been any changes in your gait?
Not to my knowledge, no.
Okay. Do you have tremors?
Yes.
Okay. And how long have you had the tremors for?
My entire life.
Okay. Go ahead and put your arms straight out. Okay. And do you take medication for that?
Yes, I do.
Okay. What do you take?
I'm taking Indral.
Okay. All right. What I'm going to have you do now is stand up. Okay. And I just want you to walk. I'm just observing your gait. I see that your gait is steady. Your hips, go ahead and move towards me. Your hips are moving equal. Okay, any pain with ambulation?
None at all.
Okay.
None.
All right, now before you sit down, I'm gonna have you come back over here and turn your back towards me and go ahead and bend over and touch your toes. Okay, what I'm doing is I'm testing for your spine, feeling that his spine is straight. There's no abnormalities, no scoliosis. Okay, is there pain when you're turning and when you're bending over?
None.
Okay, go ahead and stand back up. And go ahead and sit on the edge of the bed. What I'm going to test for next is your cerebellar function. Okay, I want you to close your eyes. And I want you, oh, I'm sorry, I should probably explain first. Go ahead and do finger to nose, finger to nose. Okay?
Okay.
Go ahead and close your eyes. Okay? Go ahead and do finger to nose. Okay, and the other side. One more time. Okay? Okay, perfect. Okay. What I'm going to do next is just test a couple of your reflexes, okay?
Okay.
First thing I'm going to do is I'm going to check for the Babinski reflex, okay? As I do this, I'm looking, no tickling. I'm looking for your toes to go downward, which they are. In babies, they fan out, but in adults, they fan down. Okay? Check your other foot. Toes are coming down. Good. And then I'm also going to check your patellar reflex, okay? Okay, the those are
You
intact.
hit it too hard there.
Okay, so the last thing we're going to do is I'm going to go ahead and touch your range, or review your range of motion, okay? So what I want you to do is I want you to put your arms out, palms down. Okay, this is touching your abduction. Okay, go ahead and inwards. This is adduction. Okay, go ahead and put them behind your head. This is external rotation and behind your back. Internal rotation. Okay, go ahead and put your arms straight out, palms down, forward flexion, and up. Hyperextension. Any pain or tenderness with any of that?
No, no.
Okay, good. Do you have any questions? Do you feel like I missed anything?
No. Pretty thorough.
Okay, I'm just gonna
No
review.
questions.
Just gonna review my notes, make sure I got everything. Okay, I did miss one thing. With your neck, what I want to do is I want to auscultate your carotid pulse. Okay, so what I'm going to do when I say so, I want you to hold your breath, and I'm just going to listen to see if there's any bruise. If there's a bruise, it's usually a whooshy sound. Okay.
Okay.
Go ahead and hold your breath. Okay. All right. I heard no bruise. Any stiffness with your head?
None.
Moving back and forth. Okay, up and down. Okay, well that concludes your physical exam. Okay, I want to thank you for being my patient today and putting up with me, okay?
Thank you.
All right, if you ever have any questions, always feel free to call or see your physician.
All right.
Okay?
Thanks a lot.
All right, thank you.